This segment of DelmarvaLife is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
In the realm of pharmaceuticals, it seems like there is a drug for just about everything these days, doesn't it? We are, of course, aware of the dangers of abusing prescription medications, but they can be a valuable resource when they're used correctly to treat mental health disorders.
Under the careful guidance of a doctor or therapist, medicine can provide long-term treatment and improve the overall quality of life for many patients. And here to help us dispel some of the medication myths you might have, Beth Dorman. She is the CEO of For All Seasons Behavioral Health and Rape Crisis Center. Always good to see you, Beth Ann.
Good to be here.
Before we get into the medications, I want to talk about some of the myths, mental health myths, if you will,
Sure.
that we can talk about. What are they?
Yeah, so there are sometimes people say if I go to a psychiatrist, I'm going to be deemed crazy. There are people who say, there's more incidents of outburst and violence with folks who have a mental health disorder. The reality is those are just not true, and that we know that 3.5% of folks who have a mental health disorder struggle with violent outbursts, which is no different than folks who are not on medication. And in fact, more times than not, our violent outbursts are because there is a lack of mental health services involved. And so we want to really sort of dispel some of the myths and also talk about the benefits of medication, because there's a real fine line between how medication can help with the neurotransmitters in our brain, which help to balance out the brain, and that's an important piece for us to talk through.
And medication sometimes is necessary in treating mental health issues.
It absolutely is. You think about your brain as the largest organ in your body, and I always tell folks to picture the legal scale where it's equal, and sometimes when we are in need of medication, the tilt of the scale is just off slightly. And so when you think about things like bipolar disorder, when you think about things like ADHD, depression and anxiety, all of those will have a different balance that needs to be worked out. But the medication allows for the brain to find its perfect match. And sometimes it's trying different medications, sometimes it's working with your doctor to make sure that the medication is the correct medication, but all of those things become really important so that we have the best chance to live the best life.
Now, can a medication change your personality?
Well, it's an interesting question, and we talked about it before we went on air a little bit. Personalities are something that we derive in our environment, and it's something that's built from early childhood. However, when you think about someone who is depressed or who has anxiety, when you add medication into the mix, what may happen is that the personality is changed in a way that someone can re-engage. So, it always seems as though when the conversation comes up, we talk about the negative and how it impacts our personality negatively. However, there are some benefits. So if someone is depressed, and again, you go back to that balance of the brain, somebody can re-engage in life. Somebody may have less anxious moments. Those are the important things that we need to look at. And we also then need to, on the other side of it, if somebody is taking a medication and they feel like their personality has been deflated, that's a really important conversation to be having with your doctor. Because like I said before, sometimes you have to try a couple of different medications to get the mix that goes really sweetly for your own body. There are blood tests that can be done, there are genetic tests that can be done, which will help the doctors tell you this medication with your chemical makeup, with your blood type, this is the medication that will work best. So it really is not as simple as, here, just take a pill.
This is for you. This will work for you.
Yes.
Okay, so you find the one that's for you. You start the medication, you get the brain balance that you were talking about. Does that mean you're on the medication for the rest of your life?
It depends. If you have a major mental health disorder like bipolar disorder, that may be something that you need to sustain your best life. If you are someone who is working with a therapist and a psychiatrist for anxiety disorder, you may be able over time to add enough tools to your toolbox that you may be able to say, I'm going to slowly wean myself off. So it all depends on what the mental health issue is that you're working through and how it impacts your brain. We also know that there are times where when it comes to grief, when it comes to anxiety, there may be episodic times where maybe you need a medication just to get you through in the meantime. And that's an important piece too. So often we hear folks say, well, I didn't want to go on medication because I don't want to be on it for the rest of my life, but I'm really struggling right now. And that's a really important conversation to have with your doctor as well, because you're not signing up for life when you have those conversations.
Right.
And the more that we talk it through, and the more that we realize that if there's a medication out there that can make our lives infinitely better, we go to the heart doctor if we have a heart issue and we take medication. If you have high cholesterol, you take medication. And we're really blessed at our agency to have Dr. Serrato, who's our chief medical officer. And I even went to him. My youngest son takes an ADD medication. And I was hesitant. And I've been in this field for 25 years. And you know what his advice to me was, is if there's something that can make your child's day better, if he won't struggle in the morning, if he won't struggle in school, why would you not move in the direction to give him his best chance? And it was a philosophy that I carry with me even to this day, because those are the conversations that we need to be having with our doctor, coming with an open mind and really trying to work away from the stigma.
Yeah.
So is medication always used in conjunction with therapy?
So there are some folks who will go for medication without therapy. Our agency really believes that the combination of both the behavioral therapy along with the medication gives you the best combination. However, there are some people who are able to go to their pediatrician or to their general practitioner and say, here's what's happening. And general practitioners and pediatricians can certainly prescribe. And more times than not, what we find is that there may be some consultations with some of our child and adolescent or adult psychiatrists. So that's really a conversation that you need to have with your doctor, but recognizing that the medication takes care of your neurotransmitters in your brain. It isn't necessarily going to change your behavior patterns,
Right.
and that's where the therapy comes in.
You touched on the next question I was going to ask you is the relationship that we have with our physician. We can talk to them about this.
100%. These are the conversations. Before we went on the air, we talked about the advocating piece.
Right.
We sometimes need to advocate for ourselves. We sometimes need to advocate for our children. And really, the beginning of that conversation starts with, it's okay to not be doing okay. It's okay to reach out. We talk about this all the time when I come on with you all, that it's okay to reach out for help and figure out a path forward that might not look the same as it looked yesterday.
Yeah.
A wonderful, happy path.
Happy path, exactly.
Yes.
Yes.
Beth and Dorman, For All Seasons, thank you.
Thank you.